the first thing is it never hurts to talk to two surgeons if you have big questions. A little second opinion can go a long way, and that's going to be even more important. I think right now in the U.S., we have one robotic system that's fully rolled out, and that's the Intuitive platform, the Da Vinci robot for abdominal surgery. There's a few other things that are called robots for orthopedic procedures, but they're not used in the abdomen. Over the next decade, we're going to have several new robotic platforms arrived, and I think a second opinion on these type of things is never going to be wasted time, but it does take time to get a second opinion. I'm always amazed in the era of the internet. People think they've done research, and really what they've done is spent an hour or two clicking on some slides and some websites. You need to go see a second surgeon if you really want a second opinion. And the surgeon who's going to actually take care of you is the only one who can really give a completely valid second opinion. Now, most people don't need that. Most people are not, they don't have these super special needs, but that is the first takeaway, that the real person who's most to benefit from digging in a little bit on the question of, am I benefiting from the robot, is if you really have special needs surgically. And for most people, that's going to be reoperative surgery or extremes of age or weight. People over 400 or 500 pounds may benefit more. People who've had complex other surgical procedures where they've already had part of their colon removed or an ostomy, they may benefit more than others, or definitely maybe more consideration. The real honest answer for this, there's no blanket answer for robot better or worse, is what do your surgeons recommend? If they recommend no robot, then I would not use a robot. And if they are experienced with the robot, then they have the ability to really have every tool in their toolbox. So if they don't do robotics at all, then that's not as legitimate. But if they do robotics and they say, no, we need to do your procedure laparoscopically, don't push for the robot. What experience counts for in 2022 is at least 10 cases. If somebody's doing their first cases and they're doing them proctored and they want you to be one of their first cases, that probably means you actually don't have special needs. You're probably a standard or fairly easy patient. I wouldn't go against having robotic procedure as a surgeon's learning curve, as long as they're doing it deliberately and they inform you. And most do. Most surgeons are very careful about letting patients know, where they fit in this. So I would also say, if you're going to do a second opinion, and if you're going to go in with a list of questions, really try to focus on your 2 or 3 biggest questions. More than about 5 questions, they end up being lower quality questions, and you're not going to get them answered well anyhow. You could lay out a list of questions, but honestly, most people, there's 2 or 3 big questions. So don't feel like more is better in terms of the number of questions.